Okay, hi everybody. So for the social worker perspective slide, I really wanted to explain what this role would look like for a case like this. The social worker is basically the bridge between the patient, the family, and the healthcare team, as well as any other agencies that would likely get involved. According to Lewis et al. 2024, families experience deep emotional distress when a healthcare system fails to protect their loved one, and that's exactly what occurred here. So the first point that we have is provide family support and crisis intervention. So when the family learned that their daughter, who was in a vegetative state, became pregnant under healthcare professionals' care, um, the shock is overwhelming. The social worker would essentially step in right away and help the family process the situation. So that would look like sitting with the patient and their family, explaining what's going on, and explaining things slowly so that it's clear for understanding, listening and helping the family manage panic, anger, guilt, or sadness. According to Demaria et al. In 2023, families dealing with sexual assault disclosures often need immediate crisis support to handle the emotional shock. The next bullet point we have is address trauma and emotional impact. So the trauma affects both the family and the patient. The family might feel like they failed their loved one, questioned any of their choices that they've made, and fear placing the loved one in another healthcare setting again. According to Lewis et al. In 2024, families facing institutional betrayal often experience long-term guilt, fear, mistrust, and that's fitting for this kind of situation. Even though the patient can't necessarily speak for herself or advocate for herself, her trauma still matters. She went through pregnancy, labor, and sexual assault. And according to Demaria et al. In 2023, um, Demaria et al. Explains that trauma-informed care is needed even when the patient cannot communicate. Next is coordinating with law enforcement and advocacy agencies. So right after something like this happens, police, APS, and legal teams get involved. The social worker helps the family understand what's going on and make sure that any reports that need to be made are filed correctly. According to Yan 2019, any sexual assault involving an incapacitated patient requires immediate reporting and police involvement. The next point we have is facilitating patient transfer. So, after something like this happens, the patient cannot stay in the same facility. It's not safe for them anymore. So, the social worker helps move the patient to a more secure facility, and they review safety policies of the new facility and keep the family informed on what's going on. According to Collins and Murphy 2022, vulnerable adults are more likely to be abused again in poorly supervised settings. So transferring the patient after something like this happens is crucial. The last bullet point that we're going to touch on is promoting policies that protect vulnerable adults. So the social worker also helps shape long-term changes like better background checks, improving monitoring, clearer reporting rules, and stronger training. Collins and Murphy 2022 emphasizes that policy reform is essential for preventing future abuse. Overall, the social worker isn't just providing emotional support, they're managing crises, coordinating the investigation, advocating for safety, helping the family, and pushing for real change so that this doesn't happen again. So moving on to the ethical principles, we're basically going to be touching on every principle that was violated in this case. So the first principle that was violated was autonomy. So even though the patient couldn't communicate or advocate for herself, she still had the right to safety and respect. According to ANA 2022, nurses must protect the rights and dignity of patients who can't speak for themselves. And in this situation, her autonomy was completely violated. Next is beneficence. So this means doing what's right for the patient. That means safe care, monitoring, and protection. None of that happened. The patient wasn't protected, and the pregnancy went unnoticed for 9 months. Next is non-maleficence. So non-maleficence essentially means to do no harm. Not only was the patient harmed, but the harm continued when no one noticed that she was pregnant. And according to ANA 2022, preventing harm is a basic ethical duty. Next is justice. And this is about fairness and equal protection. She did not receive fair or equal care in the facility. And according to Collins and Murphy 2022, vulnerable adults face a higher risk of abuse when supervision is poor, which is exactly what occurred here. The last point we have is the ANA Code of Ethics. The code says that nurses must advocate, report concerns, and protect vulnerable patients, and none of that occurred here. Overall, every major ethical principle, such as autonomy, beneficence, non-maleficence, justice, and the ANA code, were all violated in this case.